Well, do you know the proper way to care for a wound?
Well, as I found out in this week's edition of Better Health, doctors have just uncovered the best way to treat them. It's time for Better Health, and I'm here with health expert Beth Coker with Asante. Thanks for coming in.
Thank you.
So today we are talking about wound treatment. So how has that changed through the years?
The diabetic population in Oregon has more than doubled over the past 5 years, and 25% of those patients will have some kind of lower extremity amputation over the next year. But early detection of wound treatment and advanced care can really help minimize the risk of amputation for those patients. And traditional wound care has evolved to the terms that we know now that a moist wound is a healing wound. So they keep that wound covered up, and the dressings are now designed to keep that moisture in there and prevent infection and reduce swelling. The other thing that they've discovered is compression wrappings for edema or swelling is an advanced wound technique. So there is help out there to get healing for a wound that just hasn't begun to heal after 4 weeks or hasn't completely healed after 8 weeks. That is a non-healing wound and it needs help.
Now, does Asante provide that help?
We give some comprehensive wound care in our department there, and it is provided by a group of specialists, doctors, nurses, and other healthcare workers who specialize in wound care, and they use the latest treatments, one of them being they remove non-viable or dead tissue that's around that wound. They do that using ultrasonic methods or mechanical methods to take that tissue off of there, just to promote healthy healing there. And they also want to keep that moisture on the wound, so they are applying new pressure gauzes all the time.
Now, what would cause one of these wounds?
The major causes for these really extensive wounds are diabetes. People lose the feeling in their feet and they just don't recognize that they have a pressure ulcer happening on their feet because they can't feel it. Another thing would be immobilization, a spinal cord injury where the person is lying in bed for extended periods of time, and circulation issues. Blood just is not getting to that area to heal it. So those are the major causes of wounds that we see. And Asante treats a variety of different wounds: burns, extensive burns, wounds from surgery, burns from radiation. Your cancer patients will suffer from wounds that are not healing. Pressure ulcers, those kind of wounds require really aggressive treatment to be able to heal. So don't just suffer through a wound that isn't healing. Get to your doctor and ask for help, and then you can be referred to the Asante Wound Clinic.
Great, and I think that's interesting that we all thought air out that wound, but now we'll keep it moist.
We've been doing it wrong for years.
Apparently. Beth, thank you so much. We'll be right back.